Your heart has 4 valves that ensure blood flows in the right direction. These valves open and close with each heartbeat, maintaining proper blood circulation. However, sometimes these valves can malfunction, leading to health issues that require medical intervention. If one of your valves becomes leaky, it will allow the blood to flow backward, which is known as valve regurgitation. An annuloplasty repairs or reinforces the valve. A specialized ring is placed around the base of your valve, tightening it to ensure it closes properly. This restores normal blood flow in your heart, helping it function efficiently and improving your health. In other cases, a valve can become stiff or narrow and doesn't open properly. This is known as valve stenosis and restricts blood flow. Valvuloplasty widens the valve. A small balloon is inserted into the valve and inflated, stretching it to improve blood flow. Sometimes, a valve is too damaged to repair and must be replaced entirely. A valve replacement removes the damaged valve and replaces it with a new one, which can be either mechanical, made from carbon and metal, or biological, which is made from pig or cow tissue. All of these procedures work to ensure your valves open and close correctly, so your heart can effectively pump blood throughout your body.